This morning I am saying to you, be empowered, be prepared. Knowledge is a powerful weapon in the fight against HIV. You will notice that I don't say HIV and AIDS because once you reach AIDS stage, it means HIV have won despite availability of treatment. Today I appear before you to address a critical issue that demands our attention, HIV. According to the World Health Organization, in 2021, HIV and AIDS and related diseases was the third leading cause of death in South Africa, after COVID-19, tuberculosis, accounting for 77.9% of all deaths in South Africa. Among women, HIV, AIDS, and related diseases was the fourth leading cause of death after COVID-19, stroke, and diabetes mellitus, accounting for 70.6% of all deaths amongst women in South Africa. And for men, HIV, AIDS, and related diseases was the third leading cause of death after COVID-19, tuberculosis, accounting for 86.3% of all deaths among men. These statistics are not just numbers. They reflect the reality that HIV/AIDS continue to pose a significant threat to our health and well-being. It is vital that we take this issue seriously. As members of the armed forces, we are a microcosm of the broader South African society, and we play a crucial role in shaping the health of our communities. It is imperative that we lead by example in the fight against HIV and AIDS. I urge the entire DoD family to utilize the available services such as voluntary counseling and testing. Let us not do HIV testing for comprehensive health assessment only, but do HIV testing for knowing our HIV status. Knowing our HIV status is the first step in taking control of our health and making informed decisions. Making and taking informed decisions protect not just ourselves, but also our loved ones. In addition to testing, practicing safe sex is essential. Always use a condom to significantly reduce the risk of HIV transmission. For those who are HIV negative, consider pre-exposure prophylaxis as an effective preventive measure. If you have been exposed to HIV, post-exposure prophylaxis can be a preventative measure if initiated within 72 hours and should be taken consistently for 28 days. For those living with HIV, this is no longer a death sentence. Treatment is available, and adhering to treatment plan is crucial. Taking treatment consistently not only helps you maintain your health, but also minimize the risk of transmitting the virus to others. When treated effectively and you adhere to treatment, your viral load can become undetectable, therefore untransmittable, allowing you to lead a full and healthy life. In the military context, you will be HIV positive, but you will be combat ready. It is important to understand that neglecting to take treatment consistently can lead to drug resistance, making it more difficult to manage the virus in the long run. The SAMS is here to empower you with information and to serve you in the journey of first preparation. Together, we can break the stigma surrounding HIV and AIDS and create a supportive environment where everyone feels empowered to seek help and support. Stigma is still a pressing concern that requires our collective action. I encourage each of you to be proactive, utilize the resources at your disposal, and support one another in this critical fight. Soldiers in war do not leave others behind. We are in a war. Hence, we always say, we shall assist our comrades in arms even at the risk of our own lives. Let us operationalize this part of the code of conduct in the fight against HIV/AIDS. Together, we can reduce the impact of HIV/AIDS and foster a healthy future for ourselves and our military communities and protect our mission. Be empowered. Be prepared for the fight against HIV/AIDS. Knowledge is power. Thank you.
South African Military Health Service, towards military health excellence.